Hi, this is Dr. Habib. Today I want to talk about the link between calcium and blockages. The question really is, how does calcium create blockages? I'll explain. But first, a test that might give you an understanding of the severity of the blockage. It's called a calcium score. A radiological test, when you have a score of 0, there's low likelihood of getting blockages. For normal people, up to 15 years without developing blockages. When you have a score of over 100, there is moderate risk of blockages, and when your score is over 400, very high risk of blockages. The next question is, well, who's at risk of blockages? Diabetics. Now the question is, why do diabetics have more blockages? Well, they have something called insulin resistance. Now, insulin resistance is like the body saying, I'm going to resist your insulin. And your body says, I need insulin, because without insulin, my sugar can't be converted to fuel. So this constant battle of pushing against insulin resistance makes some people run out of their insulin, which becomes mature onset diabetes. Whether you become diabetic or not, that high level of insulin, because of that resistance, your body's always trying to overcome the resistance, it turns on inflammation. That inflammation is all over the body, not least your coronary arteries. So when I say diabetics have twice as many heart attacks, this is one of the possible causes. And diabetics definitely have more blockages than the average population, because when you have inflammation in the coronary artery lining, your body tries to repair it by depositing cholesterol, followed by calcium and cholesterol. Now, that's just me giving you a mental picture, but the end result is diabetics, insulin resistance, more blockages. Well, one of the amazing things about the NIH trial is that diabetics who receive chelation, intravenous chelation, for many weeks throughout the year, found a 40% reduction in cardiovascular deaths and morbidity. That's an amazing statistic. And it was so amazing that in order to reproduce it again, they are doing a TACT-2 trial at the NIH. And again, the underlying problem was insulin resistance. And the blockages were an endpoint. And chelation was an amazing way to reverse the blockages, above and beyond what we traditionally think of lowering risk factors like high cholesterol with statins, or controlling blood pressure, or merely controlling diabetes. So the summary is this, that how does calcium cause blockage? It doesn't unless there's an environment that allows it to take place. And one of them, only one of them, or two of them, insulin-resistant oxidation. That's the root cause, and I'm going to give you the answer to solving those problems later. But one of the treatment modalities for a diabetic with blockages is chelation. By the way, at Next Health, we also do remote consults. If you're interested, click the link below.